Hello guys, welcome to Dr. Science. So today our topic is about malignant otitis externa. So in my previous video I already talked about benign type of otitis externa, and in this video we will be mainly talk about the malignant type of otitis externa. Compared to benign otitis externa, malignant otitis externa is kind of very serious because it involves the skull base. Hence, it is very serious compared to the benign type. Yes. So here is malignant otitis externa. Malignant otitis externa is also called as your skull base osteomyelitis. Now, to understand this malignant otitis externa, we have to know the detailed structure of the external auditory canal. Suppose this is the external pinna and this one is your external auditory canal, and this external auditory canal is divided into two parts. The outer part is your cartilaginous part, whereas your inner part is your bony part. So once again, the external auditory canal is divided into two parts. The outer part, which is your cartilaginous part, which constitute 8 mm, and the inner part, which is the bony part, which constitute nearly 16 mm. So in total, the external auditory canal is 24 mm. This entire external auditory canal is 24 millimeters. Now, this external auditory canal, especially the bony part, is in close association with the temporal bone. So we have to understand the structure of temporal bone. Let's draw a small diagram here. This is your skull, and this skull is divided into three fossa. The fossa which is in the front is called as your anterior cranial fossa, and this one is your middle cranial fossa, and the fossa which is present at the back is your posterior cranial fossa. And here is the nose of the patient, and these are the ears. So there is a bone which is present in the middle cranial fossa, and this bone is your temporal bone. Here is your temporal bone. We will draw the detailed structure of temporal bone here in order to understand it clearly. So this is the temporal bone, and this temporal bone have an apex part. This is the apex of temporal bone, and here is the petrous part of temporal bone. And finally we have the lowermost one. Here we have the tympanic part of temporal bone. What is this? This is nothing but your tympanic part of temporal bone. So the temporal bone is divided into three parts. One is your apex, the petrous, and the tympanic part. So what are the structures that are lying in the apex of temporal bone? That is your cranial nerve number 5 and cranial nerve number 6. Cranial nerve number 5 and cranial nerve number 6 are in the apex of temporal bone. Now, what are the structures that are present in the petrous part of temporal bone? The petrous part of temporal bone usually have the internal auditory canal or the inner ear, through which two main nerves are passing. One is your cranial nerve number 7 and cranial nerve number 8. So cranial nerve 7 is nothing but your facial nerve, and cranial nerve number 8 is your vestibulocochlear nerve, which are passing in your petrous part of the temporal bone. Now we have to see what are the parts that are passing through the tympanic part of the temporal bone. So here is the external auditory canal. I already told you the external auditory canal is divided into the outer cartilage and the inner bony part. So the bony part of the external auditory canal, is in the tympanic part of the temporal bone. And not only that, you have the middle ear, which is present in the tympanic part of the temporal bone. So what are the structures present in the tympanic part of the temporal bone? One was your external auditory canal, especially the bony part. And not only that, we have your middle ear cavity. And what are the structures present in the apex of the temporal bone? It is your cranial nerve number 5 and cranial nerve number 6. I hope you are clear with this. Now we will see what is happening in malignant otitis externa. Again, this is the pinna, and here is your external auditory canal. This is the bony, this is the cartilaginous part, and this is the bony part. I already told you that this bony part is present in the temporal bone, especially the tympanic part of the temporal bone. Tympanic part of temporal bone. So imagine if there is an infection present here, especially in elderly or diabetic patients. These elderly diabetic or immunocompromised patients such as HIV people, these people are at increased risk of developing Pseudomonas infections. Now whenever there is a Pseudomonas infection, obviously this Pseudomonas infection loves to eat the bones, and especially the bony part of the external auditory canal. So as you can see, there is Pseudomonas present in the external auditory canal bony part. Now eventually this Pseudomonas will eat the bone and it will enter into the temporal bone, which is the tympanic part of the temporal bone. And if it eats the temporal bone, it can have the access to the middle cranial fossa. So in malignant otitis externa, especially the elderly people will get this Pseudomonas infection, and this will lead to middle cranial fossa involvement. So basically they will come with an ear infection, and this ear infection will spread into the brain. Hence this is called as your malignant otitis externa or skull base osteomyelitis, which is very, very serious condition. Now what are the clinical features of these patients? The clinical features are, one is these people can have hearing loss sometimes, and these people have purulent bloody discharge from the ear, and the most important one is your facial nerve palsy which is the most common one. Now, why these people are having facial nerve palsy? We will try to understand here itself. As I already told you, the tympanic part is having the external auditory canal, right? So if there is an infection here, the infection will involve the surrounding structures, and the surrounding structure is nothing but your inner ear, which is having your cranial nerve number 7. Hence these people can have facial nerve palsy. I hope you are clear with that concept. Now, what is the treatment in these people? The treatment is very simple. We give third gen cephalosporins, such as your ceftriaxone. So that was about malignant otitis externa. Hope you guys like it. Thank you guys.